Hello and Assalamu Alaikum, I'm Raja Saror Sohaib and welcome to the special episode on City 2 TV. Today we're present at Dr. Akbar Niazi Teaching Hospital where we are discovering about wellness together. We're talking about liver transplant, liver care, and just to give you certain facts about liver problem, we know that it is one of the most important organ in the body. It's a powerhouse organ and it carries out more than 500 different functions. It consists basically of 13,000 multiple chemical productions which take place within our body. And in Pakistan it's a major problem right now that a lot of people are facing liver problems and liver diseases, which we're going to talk about right now. Well, Dr. Akbar Niazi Teaching Hospital is holding this seminar which is being delivered by a very special guest that I will introduce to you in just a bit. The main purpose of this seminar is to talk about the liver problem and liver transplant and to bring about solutions that can be incorporated in the society for the betterment. So with me is a very competent surgeon who's also a liver transplant surgeon all the way from Turkey, Professor Kamil Yalçın Polat. So he is from Istanbul, Turkey, from Memorial Hospital, and he has been involved in this field for quite some time, has done more than 1,000 surgical operations, and he has a success rate of 94%, which is wonderful. So sir, my first question to you would be, it is as simple as asking you about, first of all, that when someone is faced with a liver problem or there is something that's going on with them, what is the first thing that they need to recognize and how can they get their diagnosis done on an early stage?
Liver disease is very special disease. If the liver is working less than 10%, the patient didn't get any symptoms.
Right.
So it's tolerated actually. Liver is very bloodly organs. Liver surgery is very difficult thing.
Right.
Very special area. And hepatobiliary surgery and liver transplant is totally different thing from the surgery. We are doing liver transplant, living donor liver transplant mostly in Turkey.
Right.
In our center, most liver transplant, living donor liver transplantation, biggest one in the Turkey, in Istanbul actually. Last year we performed 170 liver transplant.
Right.
So oldest patient actually 80 years old, and youngest one is 3 months and 4 kilograms. So that means we are doing every patient, if possible, going to do the liver transplant. So transplant need some big team actually.
Right.
This is the multidisciplinary science actually.
Involvement of a lot of different people who come together to perform this procedure, right? I also want to know about the main reason to have a liver transplant, because
yes.
we know that liver can regenerate itself by itself, right?
There are 4 main regions:
right.
Chronic liver disease, and HCC patient, tumor patients, and acute liver failure, and metabolic and genetic disease sometimes goes to liver transplantation. But in Pakistan and Turkey, we have a lot of hepatitis B and hepatitis C patients.
Which is a viral disease?
Yeah, viral disease.
Yeah.
So in our series, more than 50% hepatitis B. But hepatitis C is going down because some medical medicine solve the problem in hepatitis B, hepatitis C.
Okay.
But we are still growing the hepatitis B and NASH, non-alcoholic steatohepatitis, means obesity.
Right.
And fatty liver.
And that it's a major problem in Pakistan.
Yeah, it is growing actually. It's
yeah.
Very high level in West country, like Turkey. Okay. So in pediatric patients, the problem is the genetic problems.
Yeah.
We are saying bile duct problem. Genetically there are no bile duct.
How much do you think environmental factors or even things that we are involved in, for example, our habits like drinking alcohol, for example,
yes,
can contribute to cause liver problems in your body?
Yes. If the patient has taken the alcohol and the patient is obese, that's the reason.
Right.
Main reason actually. They are going, that actually, if we do the transplant, if we will do the transplant. So actually we can protect the patient to go to liver transplant. Hepatitis B, newborn, we can get the vaccine. We can protect the patient, hepatitis B patients.
And do you think it is more prevalent in Pakistan?
Yes.
Because we have a lot of problem with the safety measures that we take while performing these procedures.
Yeah, I know. We have to actually, friendly to country, too much, correlation with you. Doctors and faculties and hospitals. So yeah, I have a lot of experience. I'm gonna give your doctors my experience. They're gonna give some experience.
So I do want to know about medical tourism from you, because obviously you've come from Turkey and you are here in Pakistan to give this, to hold this seminar, and then you will be in Lahore and Karachi as well,
yes,
right?
Yes.
So I want to know that how important it is for different cultures to, come together and fight against this disease, and how important has the role of medical tourism been in this, area, especially considering the fact that it's also contributing to the economies of both the countries, right?
Yes.
And in
yes,
Pakistan,
yeah.
we do need a lot of investment.
Yes. But Pakistan is growing actually.
Yeah.
This is the fourth time I am here. So every coming here, I saw Pakistan is growing.
Yeah.
So in terms of everything, not just the medical issue.
Wonderful.
So in Turkey, Turkey has a very special medical specialty. So they are coming people. Europe. America. Russia. East, Middle East. They are coming. All is coming. Turkey is actually a rising star in the medical issues.
Right.
Yes.
Right. So it's a very good place for Pakistani patients to go to as well and get their treatment done. I want to know in the end that what do you want to suggest the viewers right now who are watching you? How can they take care of their liver, and how can they avoid the procedure of getting a surgery or a transplant?
I can say some checkup is important.
Right.
After the 40 years old, we have to check, every 6 months.
Right.
Just biochemical lab test and ultrasound, simply actually. So we can get some sign of the liver disease.
Right.
Yeah.
So
special doctors, if any problem in the lab test, you can go special doctors. Who? Gastroenterologist, for example. Okay.
All right.
So checkup is important, and if the patient relatives has a hepatitis B or C positive,
so there are more chances for it.
We have to check myself. Ourselves can lab check.
Genetics can play a big role, right?
Genetics are the third actually things.
All right. I think that was very insightful. Thank you so much, sir, for being here and talking to us.
Thank you very much.
And have a great stay in Pakistan.
Yeah, I'm gonna help your doctors in here, just the education for the liver transplant.
Wonderful.
I hope we will create the liver transplant here in this hospital.
I hope to.
Yeah, near future.
Wonderful. Thank you so much.
You're welcome.